So hello, my name is Jo Bennis. I'm the Chief Nurse at Peterborough and Stamford Hospitals Foundation Trust. It's a two-site hospital and it's an acute provider. The workforce challenges that we're having in my organisation are no different to what they have been both regionally and nationally. We have a shortage of registered nurses at the moment and some challenges with making sure that we have enough students to enable us to fill those vacancies with registered nurses.
I'm Julia Hunt and I'm the Director of Nursing at the James Paget Hospital. James Paget Hospital delivers acute care. We have difficulties recruiting to our organisation because of its location. It's right on the very east coast and that doesn't always attract people to work in that area. We face challenges across the whole of our workforce, but significantly in our nursing workforce.
The Good Practice Guide that's just been written and is a really good document to enable us to look at the key strategies really for recruitment and retention. It's very concise, it gives some really good guidance. I think my favourite bit of the whole guidance document is the appendices, which is sharing of best practice across other organisations and how they've addressed some of the recruitment and retention challenges. It also gives you good contacts to increase your network, to be able to have those conversations and look at how they've maybe done things differently to what you have.
The Good Practice Guide is a very useful resource. It's good to dip in and dip out and see the experience that other people have had and find within the resource those names of people that you can connect with quickly to learn from their experience and to share the learning that you've had as well.
We have employed lots of strategies to work with our universities to look at how we can best increase our nursing workforce and midwifery workforce. We work very closely with the university and jointly with the university, particularly with students. So we have been out with them collectively to job fairs, into schools, to offer a try before you buy concept within the hospital, work experience for students of the right age, and to ensure that we are heavily involved with the recruitment, which is values-based. With the university, so we recruit with the universities involved in the interviews and make sure that the students both have the values that I would want them to have for our organisation, but also the values that we'd want them to have as a nurse.
Because the James Paget experiences the difficulties with recruiting, that means that we've had to really think about how we engage with our local HEIs, and also we do particularly look at our local schools and how we work in partnership with them. So we believe about the getting in early, going into organisations, going into schools, meeting students, meeting youngsters to actually encourage them to come into healthcare. So we can support them with apprenticeships, foundation degrees, and obviously our intention would be to encompass the nurse and associate role as well, but we can give them a clear pathway for career progression, and we are an organisation that can support them to achieve that. I think with the move from bursary to loan, the work that we've already done and that there's evidence of is that we can give an individual good value for money. We're a supportive organisation, we'll help them succeed and they'll achieve their ultimate aim to become a registered nurse. But what we want to do is give them the opportunity to work within an organisation that has a record of being a good employer. And what we will do is give them a fulfilling career.
The work we undertake with potential nursing students, we go out into the schools, we offer them a time to come into the organisation to do work experience if they're at the right age group that the schools offer them work experience with us in healthcare. And we also offer them the opportunity when they're getting towards the end of their year 13 to do work experience and also if they want to maybe apply to work as a healthcare assistant.
Within the organisation, we've experienced the Children's Takeover Day. We've done this several times now, and it's brought much enjoyment for all those who are involved, including the board of directors to whom they present to. So the children come in from the local schools, and it's usually facilitated by the paediatric team, and they come into the organisation and they go behind the scenes and they see what roles are, and they actually take over and do those roles. Obviously very much supported, but they love it. They absolutely love it. They get great enjoyment from it. We get to see that, we participate with them, and then they go away, take this back into the schools, have the conversations, and then they bring it back and actually present to the board of directors. And what we have found is absolutely their thinking, they are so practical, so logical, and they really make you as a director reflect upon actually what it is you're doing in an organisation. It's such fun, but it's such a healthy process, and actually what it does, it engages those young minds at a very early age into thinking, actually, nursing is potentially the career pathway for me.
Most recently, we have spent a lot of time and focus on marketing our organisation. It's a very competitive market. We have to work very hard to show what we can offer that other places can't, to make us attractive as a potential employer. We've worked with a local company to Peterborough who have helped us pull together some fantastic marketing materials, both videos, headshots, clips. We are also advertising on social media, so we use Twitter a lot, WhatsApp. I don't begin to pretend I know how to use WhatsApp, and Facebook. And we've had an awful lot of interest through the social media route. But looking at quite often the largest age group of our potential recruits, that's the media they use more frequently nowadays. So the benefits of undertaking these types of schemes before they join their nurse training is for people to understand what nursing is really about. It sounds really ironic to say that they often think it's going to be like Holby or Casualty, but actually the reality of what nursing is like in the modern age and actually now is very different to what you see it glamorised on the TV. So we don't want to put them off, but we want them to understand exactly what it's like to come into healthcare, to see the types of patients that we treat and care for on a daily basis, and also what it feels like to work as part of a bigger team and how that team actually works and what the routine, for want of a better word, is on a daily basis. So the work that we've undertaken with the university, prior to being the chief nurse at the hospital, I was the deputy chief nurse and the non-medical clinical tutor, and also responsible for ensuring that we place students in the organisation. So I have been heavily involved with the university, and members of my team are now, to make sure that the programmes that we input into the programmes for nurse training, that we work collaboratively to do marketing together, that we go to job fairs together, and actually that we have some joint marketing material. So we can very clearly articulate how the synergies and interdependencies between the university and the hospital work, and likewise the university can do the same. We have a really good close working relationship, particularly with the Peterborough aspect of Anglia Ruskin University, but with the university as a whole. The Grow Your Own agenda has really taken off in the last 18 months to 2 years. We have spent a huge amount of time looking at and working with the university and Health Education England on the flexible nursing programme, which gives our unregistered workforce an opportunity to train while they are still working and to work towards becoming a registered nurse. We've also looked at assistant practitioners and implemented the assistant practitioner programme, and more recently we are one of the trial sites for the nursing associates. So our first nursing associates have just started.
As a senior leader, and as particularly as the director of nursing, it's important that when they join the organisation, I welcome them. I go and meet them. I think that's very important. They see you as a role model, a leader, and they know that they have an open door to you. So they see you as that person that leads the profession within the organisation. That's essential, that they know that's your role and that they find you approachable and they're quite clear about what the expectations are. Then it's also about having the framework within the organisation to support them whilst they're there in practice. We have roles that are embedded in practice so that they have that resource there available when they're in practice, working alongside of them, supporting them, working in a very close liaison and partnership with the HEIs. But those roles that we employ, the clinical educators, work alongside of them within the establishment, supporting them throughout their stay. And also the very important part of that role is to support those that are mentoring them, those that are given that formal support to them in their practice. So it's live, they're living it every day, they're feeling it, they're supported every day to keep them motivated on those good days and perhaps those not so bad days and the challenging practice environments that they find themselves in.
We have undertaken a huge amount of workforce projections, as every organisation does, to understand clearly how many student nurses or registered nurses we will need in the future. We've looked at different ways of attracting individuals. So there's the newly qualified, so going with the student nurses, interviewing those, getting them through their 3 years training and then them qualifying and actually having a job at the organisation. But we've also worked very closely with the University and Health Education East of England around the flexible working nursing programme, so that we have healthcare assistants, so unregistered nurses who currently work within teams who want to be a nurse but don't necessarily want to go full-time to university. So we've worked very closely to ensure that we have developed the right type of programme to allow them to be work-based and then do their nurse training, so they continue to work while they're training to be a nurse. So those often end up being staff who are very committed, live locally and actually want to stay local, so that's really good. We've also looked at a lot of band 1 to 4 development, so to be very clear around career pathways, how you can get the relevant qualifications to become a nurse or to progress on to be an assistant practitioner, or more recently to join the nursing associate trial that we're undertaking.
We encourage the students to think of us as a family because they get that support. They know where they fit within that organisation, within our organisation, and they know where they feel safe within there. But they know that with that comes challenge and expectations, but that's the same with any family, their boundaries. People know where their roles are and they know where their fit is within that. And that makes them feel safe and that makes them feel able to achieve. And that's what the focus has got to be about, is about them achieving their potential within their practice, within their training. And I think along comes with that is ultimately that feeling of, well, I want to be a part of this family, and with that comes loyalty, and loyalty to the organisation makes them want to stay. Feedback that we get from students is integral to our workforce strategy. It also reflects our values and behaviours. If we don't get such feedback from students, then we have to question ourselves as an organisation as to, are we truly living by our values and behaviours? The feedback that we get from students is a thermometer of that. And we know nationally that that's been recognised essentially that as a thermometer of any organisation. You need to listen to what your students are telling you. So we put great emphasis upon that.
The Local Sustainability and Transformation Programme, the STP, has a whole work stream on workforce. We have been working collectively and collaboratively to look at how we can offer better offers of employment to potential students. So rather than just offering a post to a student within my acute trust, is how we could offer rotational programs across the whole health economy. And what I mean by the whole health economy is, you know, they can go work in a GP practice, they could be in a care home, they could work in the community, and then they could come into the acute trust. So they basically see the whole pathway for the patient, and we offer those rotational programs. I currently, as a chief nurse for the patch, chair the education group. So all of that work comes through the education group, feeds into the local workforce advisory board, which then feeds into the STP. And more recently, I'm also working with someone from Health Education East of England on a business model for recruitment and retention. The benefits for the future workforce are the fact that really we have different routes, more opportunities, and it means that we are going to have more registered nurses coming out at different times and through different periods of time. So what I mean by that is that currently the students qualify twice a year if they do a full-time 3-year programme. We'll still have them qualifying twice a year, but actually instead of waiting and getting them a 3-year programme, we have different students joining at different periods on that 3-year training programme so they can step on the second year, and that means that we have more students available to us than we would have had using just the one traditional route.
When the individuals join our organisation, when they start their training and they come to our organisation, it's very important that they recognise there's a balance between their time spent in the HEIs and their time spent in practice. So as the lead nurse, as the director of nursing within the organisation, the person that's representing their profession that they've chosen, it's important that they meet me at a very early stage. I think how we need to build upon this, positive experience that we've had is also to look for some formal evaluation of it, and we're participating in some relevant research around that. But I also feel that we need to go and test it wider. How can we do this in a much more formalised way in partnership with education providers? And I don't mean HEIs, but with local schools. There are examples elsewhere within the country where health organisations have partnered up with schools to provide health academies. So that's an exciting thing, and it's not to say that can't be done in Gorleston, Great Yarmouth, Norfolk by the James Paget. So we want to push ourselves further, building upon the very positive experience that we've had so far.
The reason I would recommend what we have done at Peterborough and Stamford, and also what has been articulated in the Good Practice Guide, is it gives you a really clear focus on the key factors and strategies to help you retain and recruit. The learning from what we've undertaken in our organisation would be continue to make time to spend with potential recruits and students all through their programme, and that's from myself as a chief nurse through my team down to the ward managers and the teams on the shop floor, to make those recruits, potential recruits and students feel valued, to feel part of the team and not just somebody that nips in for 2 months, rotates around and leaves. And actually to make sure that we offer them the right quality learning environment to enable them to get the maximum they can out of their training, and really to keep reiterating those messages and to make them realise that you value their contribution to the wider team.
I think the next steps for us as an organisation, and for myself as the Director of Nursing to lead that, is to continue working with the Develop Your Own principles, is to look at supporting the workforce to recognise their own ability and develop along a career pathway and provide that career pathway for them. But it's also to work more closely with schools in the area to actually look to how we can support them to develop a closer connection with the organisation. Elsewhere in the country, there are such things as health academies that are linked to their local hospitals. Well, I think that's an exciting opportunity that we could explore at the James Paget Hospital.
Key aspects I would want other people to take away from the learning that we've had in my organisation is to make sure that you look at potential recruits very early on, to work very closely with your university to attract people while they're still at school or of school age before they can apply for university, to offer the opportunities for them to come and try before they buy, so to see what it's like in the organisation and to invest that amount of time to showcase your organisation, really, to then reap the benefits in the long term. For me, a key thing is to make sure that I have in my diary when the students come in to the organisation to have time to spend with them, to see them both in the classroom and also in practice, and to take the time to take their feedback to change the way you can do things. To be quite innovative and be influential in how you can utilise other strategies to recruit. So looking at the flexible working programme, looking at potential rotation opportunities, and working with your local other local organisations to make sure that you can share local lessons but also make a good experience for the students.